Over to you.
Thank you very much. Delicious, Steve. Okay, if a cancer diagnosis wasn't stressful enough, the impact it can have on your relationship is pretty tough to swallow. According to the journal Cancer, a woman is 6 times more likely to be separated or divorced soon after a cancer diagnosis than if the man were the patient. Now, one reason, losing that intimate connection, but there are treatments to help. From Wayzata Cosmetic Surgery and Spa, we want to welcome Dr. Lisa back to Twin Cities Live. It's so nice to see you, Dr. Lisa.
Nice to see you.
This, we've talked about this a little bit before in terms of how unexpected this side effect can be for women when they realize that they've got all this joy and pride in completing cancer treatments and sort of winning that battle. And then they realize that part of them, that intimacy, is really missing. What is that like for some of your patients?
In one word, devastating.
Yeah.
It's unanticipated, it's not talked about, as a potential side effect of the treatment. And so it completely takes patients unaware. And they're devastated because they may, if they had breast cancer, they may have been aware that there might be mastectomy, hair loss, but nobody talks about the devastation from the waist on down.
Yeah, this is important to talk about. So it's really dealing with the treatment, because the cancer itself isn't necessarily causing you to have difficulty with intimacy issues. It's the treatment. Now, for breast cancer, tamoxifen is something that a lot of women know that word. That's a treatment. So what is that? Is that a drug? What does tamoxifen do?
Tamoxifen is something that suppresses hormone production.
Okay.
So during cancer, commonly people get either chemotherapy or radiation, which actually might knock out the ovaries. So it can cause premature menopause in many women to begin with, but tamoxifen is the added thing. It's like the nail in the coffin that truly suppresses all hormone production. And what this leads to is vaginal dryness, loss of elasticity, really things become so painful that having sex is just not possible for many patients.
Yeah. Ovarian cancer is another type of cancer that women can deal with. Radiation and chemotherapy, really typical treatments. So talk about some of the side effects from that maybe you're not really expecting.
Yeah. So ovarian cancer is similar in terms of the chemotherapy and radiation also causing premature menopause. They don't typically need to go on tamoxifen. However, most of the doctors who treat ovarian cancer will discourage their patients from going on any type of hormone replacement therapy.
Okay.
So radiation in and of itself can actually cause a lot of skin changes, damage to the skin, which would include potentially that to the feminine region as well, leading again to painful intercourse, painful intimate relations, which really precludes their ability to be intimate with one another.
Now, I love that you have some solutions for this, but I wonder too, are women do they feel almost guilty coming to talk to you about this because they feel like, I should be so grateful that I have my life. Why should I expect that I should have to have my sex life? My sex life isn't essential. Is that what women are kind of going through?
Well, that can be one of the things where there's some shame involved or the embarrassment, because again, commonly this side effect is not discussed.
Right.
So they're thinking they're the only one. They don't necessarily know that this happens to many, many patients that are cancer survivors. But you're absolutely right in terms of feeling like, well, I should just be happy that I'm alive.
Yeah.
Of course that's the goal.
Yeah.
But ultimately, if you're not able to have intimacy with the person you love, it can really make a huge difference in terms of your relationship, which that statistic that you mentioned, up to 6 times increased incidence of divorce happening for women after cancer, I think that really speaks to that as well.
Well, I love this idea too of more and more doctors talking about, needing to talk about these types of side effects to warn women, and then making sure that women feel comfortable to come to you after and figure out what we can do. So the Mona Lisa touch is something that's like this magical, amazing thing that can make a big difference for women post-cancer and can help to alleviate some of these troubles?
Yes, absolutely. Mona Lisa Touch is a new laser-based, which is a light-based treatment that basically penetrates the tissue within the vagina. It stimulates what I call basically pay dirt, which is the collagen.
Okay.
It's almost like it is causing the cells to turn back on to start producing moisture, elasticity, new blood flow,
So this is kind of a
oxygenation.
visual image of what the difference might be.
This is an actual biopsy of patients before and after. Before, the real thin Purple up at the top means that it's very, very thin. There's little or no moisture. And you can see in that before picture, it's a little lighter in color.
Yeah.
The after picture, there's a very thick upper stratum corneum. Basically, it's the upper layer that has thickened. And you see how it looks redder? That basically means that there's more oxygen, more blood flow to the tissue. This is actually, again, one of the wonderful things because it's stimulating the body's own healing response to do the work. It's not surgical, there's no incisions, there's no downtime, there's no side effects, there's no hormones. So patients are actually able to do this treatment without worry that it's going to stimulate the cancer again.
Then do you use that in combination with Thermiva, or is that a separate mode of treatment?
So Thermiva is a separate treatment that is a newer modality. It has been shown to also improve the moisture and elasticity, perhaps not quite to the degree, but very similar.
Yeah.
It's a newer treatment, just as there's lots of different options out there now. Thermiva is one of them. But Thermiva also helps to upregulate the basically sensation and nerve conduction, which is also a very important aspect of things as well, and therefore really helping to allow women to experience the intimate experience.
Oh, Dr. Lisa, thank you so much for being here. I
I'm
really
thrilled to be
appreciate it. I think
here.
talking about this is so important because women who are going through cancer don't deserve to not be able to live their fullest life after they have finished treatment. It's amazing.
It gives them hope.
Yeah.
And that's exactly what my patients say. It is life-changing. It gives them hope.
Thanks, Dr. Lisa. So you can join Dr. Lisa on September 22nd for an open and honest conversation about women's intimate health. If this has kind of given you that hope that you can have a conversation about it and look for some solutions. The event is at Wayzata Cosmetic Surgery and Spa. It begins at 4:30, and you can find all the details on TwinCitiesLive.com. Big thanks to Wayzata Cosmetic Surgery and Spa for sponsoring Twin Cities Live. All right, I'm going to send it back over to Steve.